Changes to price transparency resulting from legislation like the No Surprises Act has really transformed Chargemaster Maintenance. I had the chance to talk about this with Melissa Deuel, System CDM Manager and Revenue Integrity at CommonSpirit Health. We talked a little bit about how she got her start in healthcare, what motivates her about her current position at CommonSpirit, and what she's looking forward to discussing as part of our Chargemaster Maintenance panel taking place at the Revenue Integrity meeting. Hi, Melissa. Thanks so much for joining us today.
Hi, thank you for having me.
Really appreciate you coming on. To get started, could you share with us a little bit about how you got your start in healthcare and some of the roles that you've enjoyed thus far?
Yeah, absolutely. So I decided to get into healthcare actually right after I had my daughter. So I was working at the time in criminal justice. I was working at a state attorney's office in Key West, Florida. And it was a good job. I liked it. I had my bachelor's in criminal justice. But I don't know, after I had her, I just had this kind of overwhelming urge to change careers and do something where I could help people and just give back. So that's when I decided to go to nursing school and become a nurse. So I did that and worked in various different settings at the hospital, from critical care to ER, pre-op, post-op, trauma, and then made my way into the outpatient setting. I was managing an outpatient infusion center for a while. And that's when I really decided that I liked the business side of healthcare too. So I decided to go back and get my MBA. And after I got my MBA, I started working in revenue integrity. I got a job as a nurse auditor, kind of slash revenue integrity manager, and learned everything about the coding and billing side, something that I hadn't, ever really worked in before. But I knew the clinical side. So learned the coding and billing side and really just kind of fell in love with the revenue integrity field. And so that's what I'm still doing now. I've changed jobs a couple of times from that first role, but still working in revenue integrity. And it's a dynamic industry. There's always new things. It's always changing. So it's kept me busy.
Absolutely. And I love that you got your started in healthcare because you wanted to help others. I think that's such a common theme in the people that I talk to who have worked in frontline roles as you have, actually providing care. And I think that brings such a humane and human approach to the job, which is really wonderful.
Yeah.
Tell us a little bit then about your current role at CommonSpirit Health. What motivates you about your current position there?
So in my current role, I am working at CommonSpirit Health. So I'm part of the corporate revenue integrity team. So my role is System CDM Manager, which gives me kind of oversight of all of our facility CDMs. So we have over 100 hospitals. CommonSpirit, if you're not familiar, was formed in 2019. It was a joint venture between Dignity Health and Catholic Health Initiatives. So a lot of the work that I do is, trying to come up with implement best practices and strategize to try and standardize things across the organization as much as we can when it comes to the CDM.
Wow. Absolutely. With 100 facilities, that must be just an enormous task.
It is. Yeah.
It's really something.
Some days are just crazy, but there's always something to do. I have a great team of people that I work with, and across the organization, we have different structures when it comes to, who supports the CDM. Some sites have their own CDM analysts, and others report up through me. I have a CDM team myself, and so there's lots of people to work with, and it definitely keeps us busy.
Absolutely. Well, we're really looking forward to having you join the Chargemaster Maintenance panel coming up on March 14th as part of our Revenue Integrity program. Could you share with us just one aspect of CDM that you're looking forward to discussing with the other panelists and with the audience during the meeting?
Yeah, there's so many things that we could discuss, so many topics. I think something that's, that I've been spending a lot of time working on lately, and it's really a challenge, I'm sure, for lots of other revenue integrity leaders across, the country is the challenge of price transparency, coming up with these, price transparency files that have to be posted online, and, trying to gather all of that information. The data that needs to go into it is, it comes from so many different places. There's things that don't always live in our CDM entirely, like pharmacy or supplies. And trying to put all that together is difficult. So I would love to, the opportunity to talk to other folks and ask them how, they're accomplishing that. And, maybe we can learn from each other and figure out, how to approach it.
Absolutely. I think that's a great response, and something that we'll definitely want to talk to the audience about and the panelists to see how different people are approaching that. Well, we really look forward to the meeting coming up in March, as I mentioned. And thank you so much for sharing with the audience and with me a little bit about your background. We really look forward to having you on the program.